Hello, my name is Jennifer Coronado. I am an exercise science major with a clinical concentration here at Georgia Gwinnett College. This is my article review presentation for Research Methods, Exercise Science 3500. So, the article that I will be reviewing today is titled Improvement of the Quality of Life and the Physical Activity Status in Women with Osteoporosis and Osteopenia Following a Physical Activity Intervention Program. The research journal which I found this article from, Biennial and PRM Research Journal. So, a little bit of osteoporosis and osteopenia. Osteoporosis is a chronic skeletal disease due to the deterioration of bone tissue. It is actually most prevalent in women due to stuff like menopause and our menstrual cycles. The loss of bone mass or low bone mineral density causes weakness and a high risk of fractures. It can be referred to as a silent disease due to the fact that symptoms and clinical signs don't typically appear soon, avoiding or preventing the early diagnosis of osteoporosis. It is not until a individual has the occurrence of a fracture or develops a disability that osteoporosis can be later found and diagnosed. Osteopenia is a similar condition, however, it is different in the fact that the bone mineral density levels are not low enough to be considered osteoporosis. Osteopenia is a condition characterized by lower than normal bone mineral density levels. As I said, it's not exactly the same as osteoporosis, but it can be an early detection of the condition. It can also lead to osteoporosis if left untreated. So, according to this article, a numerous number of studies on the effect of exercise and physical activity on osteoporotic patients does exist. However, according to their research and findings, only one study is found regarding the assessment of quality of life, which leads to the main purpose or goal of this study I found. So, this specific study aims to measure the health related quality of life of women with osteoporosis and osteopenia before and after an exercise intervention. So, like I mentioned earlier, it is most prominent. Osteoporosis is most prominent in women due to menopause. So, all of these women in this study are postmenopause and they are actually ages 45 to 65. This study was conducted or performed between April 2021 and February of 2023. So, quality of life, it can actually be measured by a number of factors, one of them being, or some of them being physical and mental health. It can also be determined or measured by a person's ability to correctly perform social, professional, and daily tasks. Quality of life or health related quality of life can be heavily influenced by any chronic disease, but especially in this today's topic is osteoporosis. So the research design, it was a prospective descriptive study. Like I mentioned earlier, it was women ages 45 to 65, the sample size being 78 women. However, only 70 were who participated and followed the two-part exercise program fully. So a little bit about this exercise program intervention. It was a 10 exercise sessions that were supervised by a physiotherapist. There was a 6-month interval between the two parts of the treatment. During this 6-month interval, there was a home-based program. Some of the things that were measured during this intervention were bone density, quality of life, and physical activity level, which I will talk about more in the next slides. So here are some methods and how this intervention was set up. These sessions started with warm-ups that included cardiovascular and neuromuscular exercises. During the first part of this intervention, which were the 10 sessions of exercises that lasted a duration of 45 to 65 minutes, this was depending and varying on each participant's health level and endurance levels. Some of the objectives of this intervention were increased movement, muscle strength and endurance, correcting posture, reducing stress, improving sleep, and well being. The 6-month interval, which I mentioned earlier, separating these two parts intervention, was a home based program where the participants were instructed to follow the same learned program that they were following prior to this. They were instructed to do these exercises 3 to 4 times a week, and any other weekdays where they were not doing these exercises, they were instructed to do some walking. So for the second part of this intervention, there were given different types of exercises with heavier weights, again, depending on each participant's level of endurance and health. So some exclusion criteria, we did talk about the inclusion criteria earlier, which was women who were postmenopause, ages 45 to 65. Here, the exclusion criteria includes vertebral fractures, severe cardiovascular diseases, second causes of low bone mineral density, neoplasms, and a resting heart rate of less than 100 beats per minute. So some of the measures here, I did mention earlier, they measured health-related quality of life. They did this by using a general quality of life questionnaire called SF36 or short form 36, the Romanian version. They also measured physical activity levels using the International Physical Activity Questionnaire. And lastly, they also measured the bone mineral density by using the Lunar Prodigy Advanced DXA system analysis. Here, statistical analysis, they actually used paired t-test to compare quality of life scores before and after the intervention, with the statistical significance being set at anything under 0.05. So any t-scores lower than -2.5 were diagnosed as osteoporosis. Any t-scores between -1 and -2.5 were considered osteopenia. Bone mineral density was also compared with healthy young adults, and the t-score was calculated, and that's where these scores came from. So some of the results here are quality of life scores pre and post the exercise intervention we described earlier. So beginning with PF, which are role limitations due to physical function, those were 63.1 plus or minus 22.6. Role limitations due to physical problems, also known as RP, were 43.6 plus or minus 41.2. Bodily pain here, BP, was 52.9 plus or minus 17.6. So the PF increased from 63.1 to 70.9, plus or minus 21.1. The RP, which were role limitations due to physical problems, increased from 43.6 to 62.1, plus or minus 39.4. That was the biggest and largest difference found in this study. The BP, bodily pain, increased from 52.9 to 61.9. So that was some of the results from this study. Here is a conclusion from my review on this article. And based on their conclusions, systematic exercise was shown to improve both physical and mental quality of life in osteoporotic patients and promotes better self-management, making it highly significant for clinicians to include it in treatment plans. So actually, according to some recommendations from clinicians and researchers based on this article, there was a lot of recommendations for physical exercise and just physical activity overall to improve um, managing this chronic disease known as osteoporosis. All right, here are some of my constructive critical thoughts. Um, First three would be some of the weaknesses or something that can be improved on. Last three would be some strengths and some benefits of this study. So, starting with adherence rate possibly being affected by COVID-19 pandemic. As I mentioned earlier, this study was performed between April of 2021 and February of 2023. This was post COVID-19. However, it can have affected the amount of participants that were able to fully participate in the whole intervention program. So that could have been a limitation for this study. Um, Another limitation is the fact that it is a descriptive study. So the effect significance of the intervention is difficult to isolate from other possible variables or factors. Some of some factors that could have possibly intervened with the results. Another limitation is a small sample size of 70. This limits the possibility to generalize both the outcomes and results to a larger population. However, beyond this limitation, this study did focus on a relevant population, being postmenopausal women. Like I did say earlier, women who are postmenopause do suffer from a lack of or insufficient estrogen levels in their body, which can lead to osteoporosis or osteopenia with low bone mineral density. So these women have increased vulnerability to fractures and reduced health related quality of life. So that was helpful for that population. Use of validated tools and questionnaires for the measures. All of the tools and questionnaires that they used in this study were validated and well established. Um, this study also provides a basis for future investigations into the effects of physical exercise on the quality of life of osteoporotic patients. So, beyond the fact of these certain limitations found in this study, I do believe this study provided a foundation for any future studies to be conducted. So, thank you so much for listening, and thank you for the opportunity.